story. So it's May of 2007. There are no more excuses. After years of debate, I'm going to Yemen to teach advanced pediatric life support and medical leadership to physicians there. I do my research and I find out that 50% of childhood mortality in Yemen is due to gastro. Fits with one of our earlier talks. 50%. Well, I know how to fix that. Hand washing. I'll go there, I'll teach them hand hygiene, and I will save lives. I'll be a national hero. They'll probably have a day named in my honor. There'll be Yemeni children named after me. My North American arrogance and I board the plane, and after almost 24 hours of traveling, our team lands in Sana'a, the capital of Yemen. We take an old Toyota van to McCullough and visit the hospital there. We tour the hospital, and as we walk in, there's one old sink at the front of the hospital. The white porcelain is stained brown, the faucet is rusted, and it doesn't work. I look around and there aren't Purell pumps at every bedside. There aren't Purell pumps anywhere. And that's the day my arrogance turned into humility. The next day we start our teaching. There's family physicians and surgeons and obstetricians, but mostly it's pediatricians. And they've come from all over Yemen to hear us talk. Our team delivers our presentations and we talk about gastro and toxicology and resuscitation, and we deftly deliver our talks to the local audience. Rather than talking about Tylenol ingestions or some designer ingestion like I do here, we talk about kerosene and pesticides. We tailor our talks to manage the sickest of kids without the latest of medical equipment, again like I would do here. We probably learn more than they do. Our talks finish by mid-afternoon, which is fairly standard, but then something cool happened, and I want to put this in a little bit of context for you. So even though I'm a physician, I'm a pretty experienced teacher as well. As an academic physician, it's part of our job. So I teach medical students at least a few lectures a year. I teach our pediatric residents, our emergency medicine residents. I teach an update course for more seasoned physicians. The point is I teach a fair amount. But what's happening in McCullough right now hasn't happened to me before, and our team calls it a knowledge frenzy. After our teaching is done, not one of the people in the audience leave. They all stay, and for hours they pepper us with every question about pediatric care that you can imagine. We have a great debate about the management of febrile seizures. Do you need to do a spinal tap or don't you? And this is what they really want. They want specific questions, specific answers, specific situations. They don't all want to know about what I thought was important. The next stop in our journey is a city called Sayoun. And on the way there, we stop in an area called Wadi Duan. Wadi Duan is breathtaking. It is Badlands meets Grand Canyon meets desert, all kind of in one area. Wadi is Arabic for valley. And there is one tribe that lives in this valley. It's not close to any major city. It's not close to any major thoroughfare. It's just a beautiful, pristine place on earth. Except for the hospital. The hospital is in the smack dab middle of nowhere. There's no patients. There's no staff. There's no money to operate the hospital, but there's a hospital. Our team tours what we call St. Nowhere. Inside, there's brand new, there's a few old enough to get that joke. Inside, there's brand new medical equipment, some of it like a blood bank fridge, not even out of its box yet. There's radiology equipment that's covered in a plastic cover like your great aunt's couch. It's never been used, probably never will be, there's no plan to use it. But a neighboring, well-intentioned, oil-rich country that wants to do good donated this hospital a couple of years ago. We carry on with our teaching. We teach newborn resuscitation to midwife students. We teach advanced life support skills to nurse practitioner and physician assistant students who are separated by gender, and the females wearing full niqab. The icing on the cake is when we teach basic life support to air conditioning students in the local technical college. But everywhere we go, no matter what we teach, we experience this knowledge frenzy. We don't speak the language, obviously, so we have an interpreter with us, though most physicians we encounter speak and understand English. We visit a local market called a souk, and the shopkeeper recognizes that we are Canadian. Thinking we're from Montreal, he starts to speak to us in French. I don't understand any French. He switches to English and engages us in a conversation about Canadian politics. We're in Yemen discussing Canadian politics. I can't do that most places at Berkeley. I also learn he speaks 7 languages, and this is the shopkeeper. Our interpreter in Sayoun is a local family physician, and he invites me to ride with him in his car between teaching commitments rather than having to get back into that old Toyota van. We climb into his car, which appears to be from the late 60s, early 70s, I'm not sure. As Kwa mentioned, I'm a bit of a car nut, but I don't recognize what this one is. He pulls out a rusted old Phillips screwdriver, puts it in where the key should go to start the car. He uses his hands to roll down the window because the little roller thingy is broken, and it's 118 degrees in the desert, so having the window down is a life-saving intervention. I learned that Dr. Muhammad has a young family. He's got 4 kids. He, as a physician in Yemen, he's required to work in the public health system, but it doesn't pay very well, so he spends his mornings working in the public system. He spends his afternoons and his evenings working in the private system. And he explains to me, my pay is $250 per month to look after my family. I give my children as much as I can, but even as a doctor in this country, I struggle to keep food on the table and provide my family with what they need. I work so much that I don't spend enough time with my young children, but I'm thankful for what I have. Dr. Muhammad is giving up his clinical time to spend time with us in Sayoun, and he says, "We're so thankful that you've come to teach us. No one from the outside comes to Yemen to help us." $250 a month, wife, 4 kids. Finally, we move on to Sana'a. In Sana'a, we travel to the main referral hospital there. It's the main referral center for the country. And in front of the hospital, there's 3 ambulances parked, one small one for neonatal transport. We're pretty impressed with what they've got. They show us their ambulances. They've got IV bags of fluids and airway equipment and C-spine collars and all the things that I would expect an ambulance anywhere in the world to be stocked with. Turns out those ambulances don't move much. They don't have paramedics in Yemen. They don't have an EMS dispatch system. So the ambulances just sit there in front of the hospital. Similar to the hospital in Wadi Douan, these ambulances were donated through well-intended, though entirely misguided, benevolence. The thing that strikes me most about Yemen is how kind and caring the people are. Such a contrast to what we think about Yemen from what we see on the news. There's so many stories I could tell you. The handcrafted local jewelry store called World Peace. The owner tells us that Yemen is a country without hope. There's no oil. We're running out of water. The spice trade has long since gone away. There's no source of money for our country. We visit a Sunni Muslim residential school. I meet a 10-year-old boy there who happens to be a hockey fan. Again, I can't believe it. I'm talking about my favorite hockey team in the middle of a Sunni Muslim school. We levitate, or we try to, with an imam. We're invited to chew cat. And so for those of you who don't know what cat is, it's a psychoactive stimulant that is illegal practically everywhere in the world, except for Yemen, where pretty much every man in the country uses it, and the majority of women. This is not what I thought of as a Middle Eastern country. Our first day teaching in Sana'a, it's time for lunch. Dr. Ida, who has organized a lot of our visits, is clearly getting excited. Plates and plates of homemade local dishes arrive, rice and lamb and goat, all perfectly seasoned, and we're excited to try it. But they want to make their Western guests feel welcome, so they've prepared a special meal just for us, and it comes in after they bring in their own meal. And you can see how excited they're getting to provide us with this special meal. It's the best Kentucky Fried Chicken I'd ever had. Yemen really was a turning point in my life. Better medical schools, better universities, better research, better teaching, better training doesn't make us smarter than the rest of the world. It's kind of the attitude that I went with. It makes us better educated. And there's smart people doing very great things with very little. At that point in my life, I don't know much about public health. I'm purely a clinician. I'm in Yemen to teach pediatrics. That's what I do. The realization at the end of our trip is that similar to the hospital in Wadi Douan and similar to the ambulances in Sana'a, teaching pediatric emergency medicine is not what is needed the most here. We're doing great work, but it's not the lectures that we've prepared. My good intentions are misguided. Brings us up to now. I've got almost 10 years of experience at various levels of hospital administration. Nearly complete my master's in public health from a very prestigious university. But over the past 8 years, my thoughts about Yemen are still simmering in my brain. And I think, God, clinical instruction's important, but if I'm ever lucky enough to go back to Yemen, on CHLA, as they would say in Arabic, then I think I need to teach change management. I need to teach strategy. I need to teach quality improvement. This is originally where my story had ended. But as I was practicing in front of my mirror, I thought, I didn't learn a thing about my own story. I didn't listen to myself. They don't need me to come in and tell them what to do. They know what needs to be done better than I ever could. Change is not about teaching. Change is about culture and about people and about place. They need a partner and they need their voice to be heard. I realize that I need to stop the assumptions. I need to stop jumping to conclusions. And I need to start listening and understanding. Thanks.